Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County Channel TV 20 and the county's YouTube page. This meeting is being interpreted in American Sign Language by Kelly Turner. Carlos Saraceda is interpreting the press conference in Spanish. This interpretation will be available on the county's webpage and YouTube page shortly after we conclude this press conference. COVID-19 positive cases in Santa Barbara County continued to increase this week. This is not good news, but frankly, it's also not unexpected. The transition from a nearly complete economic shutdown, with everyone except essential workers staying at home, to the reopening of businesses inevitably creates more interactions with people. COVID-19 positive individuals often do not exhibit symptoms. As a result, many people don't realize they have the virus. Increasing contacts are spreading the virus. The simple answer is for everyone to wear masks as often as possible. Since our last press conference, active COVID-19 cases have been trending downward. Last Friday, there were 315 active cases in Santa Barbara County, and yesterday that number had dropped to 254. A 19% decline over the week. Hospital admissions for COVID-19 patients is a more significant indicator of serious health issues with the virus in our community. Local hospital admissions had also decreased in the first 5 days of the week, but have increased the past 2 days. The 7-day trend is now effectively flat for the past week. The other number that is critically important to monitor is the number of hospitalized patients that require intensive care. Unfortunately, patients requiring admission to the intensive care units of local hospitals has slightly increased this week. The census countywide went from 17 ICU patients in local hospitals to 20 patients this past week. Fortunately, local COVID-19 treatment beds are occupied at only 8.7% of available capacity. Medical surge beds are 6.9% of available capacity, and intensive care unit beds are occupied at 16.8% of available capacity. Nearly 85% of intensive care unit hospital beds in our county are available to treat patients. We have a strong reserve in our hospital capacity that can absorb an unexpected increase in COVID-19 patients. Most tragically, there have been 6 additional deaths from COVID-19 this past week. My heart goes out to each of the victims of this terrible disease. The loved ones lost are missed dearly by their friends and family. This is a stark reminder of the serious challenge we continue to face, as we are not out of the woods yet. Many people are understandably asking, how can the Public Health Department open personal care businesses with COVID-19 cases rising in our county? The answer comes from the data generated from the specific circumstances involved in the more than 300 new cases identified this past week. The county's Public Health Department, in close consultation with the State Department of Public Health, is looking very closely at these new cases. The very small incremental contribution the reopening of personal care service businesses will have on future COVID-19 cases is not a serious threat to public health in our county. The COVID-19 pandemic is a global crisis, but it is not playing out the same everywhere. Outbreaks occur based on specific circumstances and conditions. If we're to be successful in containing the virus locally, we must target our interventions to meet our unique local challenges. Our local data points to community transmission starting from contact among family members and at workplaces. These activities are not visible to the general public, so they are not easily recognized as sources of our local community transmission. The best strategy to reducing these sources of transmission are each of us taking responsibility to redouble our personal commitment to keeping each other safe by reducing our activity, maintaining physical distance, wearing face coverings when out, and regularly washing hands. When you're making future holiday plans, please be extra vigilant about avoiding contacts that could spread the virus. The governor's mandatory face covering order should begin to have a visible, beneficial effect on community transmission across the state over the next few weeks as compliance with facial coverings increases and expands locally and statewide. I want to assure everyone the County Department of Public Health is working with all the cities in the county and the businesses and industry groups to increase compliance with safe business operating procedures. As we've mentioned before, county ambassadors are continuing to proactively visit local businesses to see firsthand how they are conducting business. When there is an observed need for improvement or in answer to citizen complaints, the ambassadors are educating business owners about strategies needed to better protect employees and customers. This collaboration is generally very well received by the businesses and is resulting in improvements in the vast majority of instances. Some businesses have described challenging circumstances with difficult customers who refuse to wear face coverings. Updating the old adage to no shirt, no shoes, no mask, no service works very well in a pandemic. Businesses that have questions about what to do and if an employee tests positive for COVID-19 can get answers on the Public Health COVID-19 webpage by clicking the Business Resources icon. Some businesses may soon learn that failure to comply with education does lead to enforcement. Businesses that consistently defy instruction from the Public Health Department will face consequences. Citizens who observe practices that are unsafe are encouraged to report these operators by calling the county call center line at 833-688-5551. Over the course of the following week, the county will be updating the data dashboard currently on publichealthsbc.org to reflect the state's now required metrics for testing, case rates, hospitalization rates, and hospital capacity, in addition to our locally generated data, which will help us all better understand what is happening on the ground in Santa Barbara County. We look forward to sharing the revised dashboard with the community next week. Since the beginning of the pandemic, our local nonprofit organizations have creatively adapted their operations to serve our community in new ways. As we enter the summer, many parents are looking for safe activities for their kids to participate in. I'm excited to learn about the Santa Barbara Museum of Natural History's Adventures at Home program. As part of this program, the museum will be hosting week-long summer camps over Zoom to safely teach children about science and nature. Small camp groups will allow for children to interact with each other as the instructors guide them through their activities. I appreciate this effort to provide local kids with a meaningful learning experience while also protecting the health and safety of our community. Thank you to the Museum of Natural History and all the local organizations that are stepping up to safely serve our youth and families this summer. We have a lot of information to share today. We'll now hear from Dr. Henning Ansorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. We are reporting 81 new cases of COVID today. There are 54 patients currently hospitalized, with 20 patients in the intensive care unit. The trend with increasing positive test results is concerning to us, but it needs to be looked at in the context of our previous and current testing strategy. Back in April and even in early May, we were only able to test really ill people or first responders and healthcare workers due to scarcity of testing materials. Since then, we have begun to test a lot more asymptomatic folks, mainly at our community testing sites. With the understanding that there are asymptomatic carriers of the virus who will show up as positive test results, we are certainly picking up some additional cases due to more testing activities. When comparing the increase in new COVID positive results to the increase in hospitalizations for COVID-19, it is obvious that the relative increase in hospitalizations is in fact slightly lower from May, percentage-wise. This fact tells me two things. Number one, the virus is definitely more widespread, but only a small fraction of these cases will need hospital-level care. Number two, the percentage of COVID-positive people who do require hospitalization has remained stable over the past 2 weeks and actually gone down from May. Fortunately, even with the increase in total hospitalization numbers and intensive care unit patients, our local hospitals and ICUs continue to have sufficient bed capacity, ventilators available to take care of our sickest. Except for one nursing home outbreak and some staff at the county jail, our contact tracers have not been able to identify other specific venues as clusters of COVID cases. This tells us that the vast majority of our new cases get infected by someone they know. We do have widespread community transmission. The virus can be transmitted anywhere. However, infections occur when physical distancing, wearing of a face covering, and frequent hand washing is not observed. We cannot stress enough how important these simple preventive measures are to slow the spread of the virus. Wear your face covering, stay 6 feet away from folks that do not live in your home, and wash your hands often. We have decided to let the few remaining personal service sectors open their doors with significant modifications and safety precautions. They have provided excellent plans on how to operate safely, and we feel confident that with these precautions in place, they are safe to operate. In closing, I'd like to reiterate to our community that we know how the cases in our community are spreading, and we know that although our case count may be steadily rising, many of our new cases remain asymptomatic. We continue to work very closely with our local hospitals and the state to ensure the path we are following is best for the health and safety of our entire community. Please be responsible, wear a face covering when asked to do so, and keep a safe distance to protect yourself, your loved ones, and the whole community. Thank you.
Thank you, Dr. Answer. Next, we have Nick Clay, the county's Director of Emergency Medical Services.
Good afternoon. I'd like to begin by providing an update on testing locally. There are several avenues in which residents can get tested, including the OptumServe community testing, healthcare providers, and other targeted testing events like previous event we held in Guadalupe and the event happening today and tomorrow in Cuyama. Community-based testing has really had two main goals. The first goal is to offer testing to a broad spectrum of the community who need it, as well as to simply just find the disease. Our testing sites, our community-based testing sites, have had high utilization and are generally going very well. Although we want to reinforce that these testing opportunities are not a cure for curiosity, but for those who have had a risk of being exposed. And this is a shift from what we have previously shared, but here's the reason why. This high utilization of these testing sites by low and no risk individuals is having an impact on testing availability for those who truly need it. We have heard of some sites even reporting a 7 to 10 day waiting list. Additionally, in certain sites, we are finding the disease, like in Santa Maria as you would expect, but in Santa Barbara the positivity rates have remained low. Additionally, we are moving our Solvang-based testing site to Buellton, which is conveniently located off of the 101 and 246 at American Medical Responses headquarters. We've heard from the community that testing results are not always received in a timely fashion, and I want to assure you all that we are actively engaged with both the state and their vendor, OptumServe. Several months ago, the state embarked on a significant undertaking, working with counties across the state to conduct 80,000 tests per day. This project has occurred quickly, but has not been without challenges. There have been a number of procedural and technical challenges that have hampered the promised turnaround time of 2 to 3 days. We have been told by the state that the results turnaround time is now closer to 5 days. They hope that this is temporary and will be resolved soon. However, this combined with the limited immediate availability of testing is causing some concern amongst our community. All of this has an impact on our ability to initiate that disease investigation and contact tracing process. If you don't feel well, please stay home. If you test positive, the Public Health Department will be reaching out to you, but please self-isolate and stay home. Whether or not we are waiting 2 days or 5 days for the results, it is incumbent on all of us to continue to adhere to the public health guidance to limit our outings to just essential needs, practice social distancing, wear a mask, and practice hand hygiene. Additionally, when it comes to community testing, we are offering another event today and tomorrow in New Kuyama from 4 p.m. to 8 p.m., which is open to the public. This is a result of another great partnership with community partners like the community health centers, the county fire department, and the Kuyama School District, just to name a few. If you would like to make an appointment to be tested at the Kuyama site, please call area code 661-766-2149. Briefly, to touch on contact tracing, it's a crucial step in the county's attempt to keep us all safe. It allows us to identify where exposures may have occurred and prevent the spread of COVID-19. In total, since we've started this process, we have monitored over 2,000 individuals with 395 contacts currently being traced and monitored. This figure illustrates just how extensive the reach of our contact tracing team is. As we have previously noted in other public events, the Country Oaks Skilled Nursing Home has experienced an outbreak. Given the community spread, it was not surprising to see positives occur within this congregate care facility. This is a fragile population, and the facility has done everything possible to keep their residents and staff safe. They've engaged with the Public Health Department early, and support was quickly offered from the state. The California Public Department of Health sent in staff to assess the site and provide additional infection control and guidance and training. To help support some staffing needs, the California Emergency Medical Services Authority deployed 2 medical assistance teams trained specifically in COVID-positive care. As a result of this collaborative effort, the facility continues to conduct routine testing as indicated by the California Department of Public Health, and they are also now reporting only 2 symptomatic residents. However, despite these successes, we continue to express our condolences to the families of those residents who have passed away as a result of contracting this disease. We continue to work closely with the state, who have advised us we remain on their data monitoring list based on increased positive case count. This is not meant to be a punitive move, but one born out of caution and collaboration to identify ways to return the county to the green check marks based on our attestation. We have received feedback from the community who shares their concern, and we want them to know we are focused on the community safety. Each decision to either enhance or release restrictions is carefully weighed. I want to close by asking our community to take these precautions seriously. Few of us enjoy wearing masks, and we miss the activities that we enjoy without restrictions. But as Supervisor Hart and Dr. Onsorg have said, it is up to us, and the fight to COVID-19 starts with each and every one of us as an individual. We have to do it, and we have to take personal accountability to ensure that our safety of our community. Thank you.
Thank you, Mr. Clay. County Sheriff Bill Brown is also available on the phone today to give an update on the COVID-19 cases associated with the county jail. Sheriff Brown?
Thank you, Chair Hart, and good afternoon, everyone. I'm here to give you an update on the situation in our jail and with our staff with respect to the COVID outbreak that I reported last week at this press conference. Last week, I reported that a total of 9 staff members had been infected with the COVID virus, and I'm sorry to have to report that since that time, we have had an additional 9 staff who have tested positive, and that includes the following list: 6 custody records staff members, our records manager in custody, 1 sheriff service technician, 4 custody deputies, 1 custody deputy sergeant, 3 custody deputy lieutenants, 1 custody commander, and our chief custody deputy. Total of 18. In addition to our staff members, we have a total of 3 inmates who have tested positive for COVID-19 in the jail. Those 3 inmates, 2 of them were in our general population. 1 of them was brought in from the state of Arizona on an extradition And all three of them are currently tested positive, but are not hospitalized. They are being treated medically at the jail. They are all in negative air pressure facilities and are being, when they're treated, full PPE is being utilized by medical staff and custody staff members as a precaution. We are have undertaken an extensive testing regimen for our staff and for the inmates. So far, we have tested a total of 322 employees. The majority of those in our custody branch, a number of those are employees who had contact with members of the custody branch. And we've also tested 155 inmates. And we, as I say, have undertaken an extensive regimen and have run into some difficulties with some scarcity of testing materials, but we are continuing to test, and our intent is to test not only the inmates and the staff once, but to do a second test to confirm negative tests for those people at least a week after their initial test. The staff and our WellPath contracted healthcare workers have done tremendous work in mitigating this outbreak and preventing further spread of the virus. And I want to just thank them and take the time to comment on their remarkable efforts under very difficult circumstances. And I also want to thank the inmates in our custody, because the inmates have also been engaged and are cooperating to keep the jail clean, to practice good hygiene and distancing themselves. And I think that this has been a factor in us not having a more extensive outbreak in the jail as well. So that's all I have at this point. Be happy to answer any questions later.
Thank you, Sheriff Brown. We also had a request for Mr. Clay to repeat a phone number.
Yes, so the number to book a community test or a COVID-19 test at our Cuyama community event happening today and tomorrow from 4 p.m. to 8 p.m. The phone number to book is area code 661-766-2149.
Thank you, Mr. Clay. We'll now go to questions from the room. Mr. Devine?
First question for me, we have this emailed in by a viewer. So how many hospital beds are there available in Santa Barbara County, and how could we be at a crisis level if there are more than 600 beds available?
Well, I think I spoke to that to a degree, not precisely the number of hospital beds, and I think also Dr. Anzorg spoke to this too, that there are increasing cases. There are actually decreasing active cases, and there are increasing hospitalizations, particularly in regards to ICU beds. But there is not a crisis in the availability of hospital resources. That is being very closely monitored, has been throughout the entire pandemic, and we are today very comfortable in saying that there is capacity in the local hospital system to handle COVID-19 patients. And that is an important message to communicate to the people. There are very different circumstances occurring all across the country. And so when people are watching the news and seeing circumstances in other places, it is easy to transfer that concern about those locations to our local community. And we are doing these press conferences to give clear, specific information about our unique circumstances here in Santa Barbara County, and that is different than it is in other places, which is why we are feeling comfortable enough to reopen those personal care businesses as of yesterday. And but that is not to mean that people should take this lightly. The messages are consistently together that we want to reopen businesses, we want people to have an opportunity for them to make a livelihood, and we want everyone to stay safe by being diligent and careful and practicing social distancing, wearing face coverings, washing hands. And if people continue to do that, as they have for the past 3 months, we will be able to maintain capacity in our hospitals, protect public safety, and have a reopened economy.
Another question for me. Yesterday, obviously, California's COVID-19 assessment tool predicted that the death toll could increase to over 225 over the next 30 days. Do you still foresee that as being a worst-case scenario?
I think it's entirely dependent on how much people practice the things that we just talked about. Our destiny is not determined in advance. It is a product of how we behave around each other. And if people are respectful and concerned about others, as they have been to a remarkable degree moving forward, we can contain community transmission to a degree that matches our hospital capacity and prevents that kind of an outcome.
Lastly, for me, 4th of July weekend obviously coming up. What precautions are you guys kind of setting forth in place with a lot of tourists scheduled to come into town?
Fortunately, with the governor's statewide mask order, there shouldn't be anyone coming to Santa Barbara County who isn't comfortable and familiar with the requirement to wear face coverings. I think that was an issue for a couple of weeks ago. People would come from a community that didn't have a mandatory face covering rule in place. They would come to town unprepared and surprised. That will no longer be the case. There won't be people coming from other communities that haven't already begun practicing wearing face coverings, and they will come to our community prepared to do that. I think that we haven't seen the benefit of that in the numbers yet because the governor's face covering order is only about a week old. But as we proceed for the next 2 weeks through the holiday weekend, I'm hopeful that we'll have compliance. And there's confusion about where to wear a mask, and I think that has been something that folks have been confused about. It's an easy decision to default. If you're confused, just put a mask on. You don't have to worry about it. Just if you're outside and you don't know whether you should have a mask on or not, just put it on.
Thank you.
Next, we'll go to questions on the phone.
Yes, first up, we have Tom Bolton with Newshawk.
Thank you very much. I have several questions, so I'll try to move quickly. My first question is for Dr. Ansorg. Can you tell us what percentage of those being tested lately have been either asymptomatic or pre-symptomatic?
We do not have the exact numbers because it would require a phone call, and if you're testing by the hundreds, that's a lot of phone calls. So unfortunately, I don't have that number, but sorry, what was
Do you have a
the other part?
ballpark, an idea?
I honestly do not have an idea either. It's because we only have the data on about a third of tested people, and I don't feel comfortable making an assumption on that small percentage.
Okay, thank you. A couple questions for Nick. If I understood you correctly, up until recent or till now, pretty much everybody has been encouraged to go get a test. And am I understanding correctly that you're saying that that's not the case any longer?
So it's a great question, and I appreciate that we've changed direction. Our intent with the community-based testing was to ensure we had a broad range of individuals who are able to get tested. What we are finding, though, is unfortunately the worried well, the individuals who are curious about if they have it currently or not, but aren't symptomatic, haven't had an exposure, aren't at risk, are unfortunately coming in volume that prevents individuals who do need that test. We are getting calls from the community almost daily in which they are unable to get a test, their employer requires them to have a test, or they want to get an elective surgery done, or they aren't feeling very well or have an exposure and they want to get tested and they're unable to get an appointment. So we still encourage individuals to get tested, but however, we are asking that if only to get tested if you have had a risk of an exposure, you are feeling unwell, you've been asked by public health or other medical professionals to direct you to get tests. A delicate balance, that's our current situation.
So are you beginning to triage then when people apply? Because right now in Santa Barbara, you can't get a test until July 9th.
Correct.
You addressed that a little bit in your comments, but how are you addressing that problem? I had people who were worried. They said they had what you just described. They had someone with mild symptoms. They wanted to get tested, and they're like, oh gosh, I can't get tested for 2 weeks.
Yeah, and that's the challenge we're experiencing with the volume of tests. So obviously, if they're unable to get to the testing site, they don't feel well, they have symptoms, we encourage everyone to communicate with their personal physician. That is always a great contact to start with. Unfortunately, because we aren't in complete control of the testing sites, they are offered to us from the state through a vendor. There is limited ability, if any at all, to really prioritize those appointments. Those appointments are booked and slotted, and then from there, we're unable to peel them back. It's just how that system is provided to us by the state.
Okay, and my final question is maybe for Dr. Ansor, I'm not sure. We've been hearing numerous reports of restaurants and other businesses closing down after staff members tested positive for the COVID. And I'm wondering, is the county health department made aware of those? And are you looking at any system that would share that information with the public? Obviously, they'd be concerned if you've gone to a particular restaurant and suddenly they're closed because of COVID. How would you learn that?
Well, COVID is transmitted from person to person and not so much from a facility to a person. So if a restaurant closes because they had a COVID positive coworker or employee, then it is my understanding that the restaurant is doing that on their own accord to protect their own employees. The Environmental Health Service division in the Public Health Department takes care of the permits and licensing of restaurants, not just for COVID, but other infectious diseases that could pose a risk to the public. And if a restaurant has to be closed because it could be a risk to the public, that follows the usual protocol, and that is different from LA County in Santa Barbara. So to my knowledge, there has not been a restaurant closed by our environmental health services due to COVID at this point.
All right, thank you very much.
Thank you, Mr. Bolton.
Next up, we have, I apologize, hold on one second. Laura Place with Santa Maria Times.
Hello. My first question is regarding something that Dr. Answerk said last week, and it was a similar question to what Mr. Bolton just asked. It was, if you could give an update on how many people were asymptomatic, which I know you just said you don't have the numbers for that, but at that time last week when that was asked, you said that the comfort you had given prior that, a lot of these cases were asymptomatic, so even though there's a rise in cases, we don't need to worry. You said last week like you wouldn't feel comfortable giving that comfort again just because hospitalizations were rising. So I know that you're saying that now we just need to be vigilant, and if we just wear masks, cases can stay down, but I'm a little confused with how that's reconciled with your comments last week about how you're deeply concerned about rates of hospitalizations.
Well, I still am very concerned about the hospitalizations. The trend is very consistent with the rest of the state, and it is a reflection of the widespread prominence of this virus. So, because asymptomatic people who don't know that they carry the virus and they feel well are possibly spreading the virus, more so than people with symptoms who will self-isolate or seek medical care. Therefore, really universal preventative measures are the best protection that we can hope for. I hope that answers your question. Having said that, we feel confident because of our hospital capacity to absorb the current disease and severity of disease that we experience in the county. It doesn't mean that I'm not concerned about those individuals who are fighting for their life in the intensive care unit. As the public health department and the public health officer, I have to look at the public's health and at the big picture, and not just at the individual, even though I empathize with the individual. And that is sometimes a very challenging situation to find yourself in. So I don't know if I can answer your question. 1 week in COVID time seems like an eternity sometimes because so many things happen so rapidly and changes happen so rapidly that I might say I might have to revise my comments from last week. But as of right now, I'm still concerned, absolutely. But I still think that if the community takes this as a challenge and keeps the preventive measures up and improves the protection of themselves and each other, then we can weather this pandemic together.
Thank you, Laura.
Okay. And can I ask one more question if
Sure.
we have time? It's regarding some comments that SLO County's public health officer, Dr. Penny Bornstein, said yesterday. And I know that she said that Marion Regional Medical Center was experiencing a surge in patients. And then later she revised that statement and said, or recalled it and said that that was incorrect. But just because there's daily and constant communication between the two public health departments, I was wondering if you know where that information might have, come from, or how that miscommunication might have happened, or if it was just an anomaly.
Sure. Mr. Clay?
So we did have a conversation with the St. Louis Public Health Department, and it was a misunderstanding of a comment that was heard about a normal interfacility transport that occurs every single day between our hospitals, and that was misunderstood to represent a more grave situation that was actually occurring.
Could you explain that just a little more? So, there was a surge in interfacility transfers. Is that what you're saying?
No, it
That
was
was
just
interpreted?
a comment that was heard about a normal interfacility transport that happened, and then it was extrapolated to mean that they were transporting more patients than normal. But that is not the case. Marion is managing and weathering the increase in hospitalizations quite well, and are comfortable with the situation they're in, and they are not transporting patients out of their facility to other hospitals in the county.
Got it. Thank you so much.
Thank you, Ms. Place.
Next up, we have Grace Aldrich with KCSB Radio, to be followed by Gianna Magnoli with Newshawk. Grace, go ahead.
Hi, I have a two-part question. What is the current county procedure for a COVID-19 positive patient in a nursing home or a skilled nursing facility? And how is the county ensuring separation of infected and non-infected patients to mitigate spread?
So to answer the first part of your question is, what is the process for a COVID positive SNF patient?
Yeah, so are the residents of these nursing facilities being transported to hospitals, or is there a hospital and home approach where medical supplies are being brought to the facility to treat the patients there?
So good question. So we have a very robust network of communication between our public health emergency preparedness team and all of our healthcare partners, including our SNFs. All of them are kept up to the latest information on CDPH guidelines, but patients aren't transferred to the hospital unless there's a medical need to do so. So many of our SNFs, when this first started, came up with plans with our support and guidance of our public health department of how to manage a COVID positive SNF or COVID positive patient and mitigate the spread to other residents. So all of them have worked on isolation plans. Of course, the goal is to always keep these residents in their current establishment unless medical necessity requires them to be transported. So they work to isolate, they work to keep the staff in donning and doffing procedures for their PPE to ensure the staff aren't transferring COVID from one room to the next. They have increased sanitation protocols, and if they have any additional needs for personal protective equipment or for sanitation supplies, they do reach out to our public health department, and we provide them as we are able.
So am I understanding correctly that a staff member at a nursing facility could immediately see a COVID positive patient and then attend to a non-COVID patient?
Not without careful donning and doffing of their personal protective equipment to ensure they're not transmitting the disease from one to the other. If there are
Okay.
scenarios in which they do sometimes cohort positive, COVID positive sniff patients, if it gets to a number in which that's required, in which case you would keep the staff in that particular area. But from day to day, they take very, very careful, precautious measures to ensure they are not carrying that disease from one room to the next without ensuring they are completely sanitized moving to the next.
Okay, thank you so much.
Thank you for your question.
And now, next we go to Gianna Magnoli with Newshawk.
Hi, thank you. I have two quick ones about hospital numbers and contact tracing. First, could you explain, this might be for Dr. Ansorg, public health is reporting hospitalizations differently over time, and the metric site numbers are much lower than they were a couple hours ago. Could you please explain why they changed and what's indicated by the new numbers on the site?
Yes, I understand that the numbers we are citing are very confusing at times, also to me, for various reasons. One is that the hospital, every hospital in the state has to report their census data on a daily basis to the state health department, CDPH. Now, I'm not exactly sure at what time their cutoff is, but then the CDPH publishes their number, and we take some numbers from the CDPH website to document that. In addition to that, to make things a little more complex, the hospital, each individual hospital also reports their discharge and admission numbers to the public health department, especially when it's about COVID cases. And they report again at a different time, and hospitals are usually quite busy places. That means their census of patients can vary from hour to hour. And it is, that's why we are trying to streamline this now. And as of Monday, I suppose, we will only report CDPH numbers to reduce this level of confusion. And I apologize if that has been causing more confusion than necessary, but it is literally because of different cutoff times when counts are reported and different agencies collecting those data.
Okay, I mean, the new numbers on the metric site are 20 patients off from the numbers that were there a few hours ago. So that seems like more than just a reporting time difference.
Are you referring to the state metric site?
Yes.
So we can't really speak to the state's
No,
metrics.
the public health department's reopening metric site.
Oh, sorry.
Yeah, I'm not sure. I haven't seen it this afternoon yet, but it is possible that they are in the process, because we just had this discussion today, they're in the process of switching to the CDPH documentation, and the CDPH documentation lags behind a day. So that's why there might be a bigger discrepancy this afternoon than usual.
Okay, I can follow up on that. And then Dr. Ansorg, you mentioned most people you think are catching this from someone they know. Can you expand a little bit on the contact tracing investigations and how you know people are getting it locally?
Yeah. The contact tracers, of course, tell the person they call and say, you may have been in contact with somebody with confirmed COVID, and they do not tell them the name, obviously for privacy issues, and then a lot of the time they get the answer, oh yeah, I know exactly. And then there are situations at workplaces, and if you follow the case, it always comes down to that at workplaces, for instance, that there were really good measures in place by the employer, but they didn't think about continuing with the social distancing while in the break room, for instance. Or we had one interesting scenario where they were very, very meticulous with keeping their social distance and everything, but they were all carpooling, together, and were buddies basically, and then forgot about wearing a mask while in the car and things like that. Just that people weren't thinking it through. And then we know about some situations when people say, "Oh yeah, we had family over, and Uncle Jim was a little bit under the weather," and then yeah, it was this family get together, and so it's usually when people come close to each other without protection, and that's why I sound like a broken record with recommending, please avoid gatherings, avoid crowds for sure, and wear a face covering to protect yourself and others, and wash your hands frequently and keep a distance. Does that answer your
thank you.
question?
Thank you, Gianna. Did you have any additional questions?
I do not.
Thank you.
Thank you.
There are no more questions on the phone.
Thank you. Because of the upcoming July 4th holiday, our next press conference will be next Thursday, July 2nd at 3:30 p.m., a different time than usual. If you have any questions about COVID-19 or any of the things that you've heard today, please call the county's call center line at 833-688-5551. As always, as Dr. Answer said, like a broken record, I want to remind everyone to continue to practice these 3 simple steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home and isolate yourself. If your symptoms worsen, call your medical doctor or clinic and follow their advice. Please continue to be patient, considerate, and kind in these difficult circumstances. We're going through an extraordinary moment together, and the way we will continue to get through this is together. So thank you for joining us.